I want to start this conversation on a warm note, reminding you that sexuality is a natural and important part of life at any age. Many people believe that as the years go by, sexual interest diminishes or simply ceases to exist, but this is not necessarily true. The body may change, the mind may change, but pleasure and intimacy remain fundamental aspects of physical and emotional well-being. It is time to discuss this subject with the seriousness and respect it deserves, without taboos and with the awareness that sexual health is part of a full life, even in maturity. When we talk about sexuality in old age, some questions arise. Does desire really disappear? Does the body no longer respond as it used to? Are there any contraindications to maintaining an active sex life? In reality, each person is unique and experiences this process differently. There are hormonal, emotional, and social factors that can influence sexual desire and satisfaction. Therefore, it is worth knowing a little more about what happens to our bodies over the years and how we can deal with these changes in a positive way. Often, decreased libido or difficulty during sexual intercourse may not be directly related to age, but rather to other factors such as stress, depression, medication use, or even communication problems with your partner. In addition, it is important to remember that the psychological component has a huge influence on our intimate life. Performance anxiety, fear of pain, or even concern about appearance can block or reduce sexual satisfaction. When there is a widespread belief that sex is for younger people, it becomes even more difficult to maintain self-confidence and seek solutions that can restore pleasure. Therefore, it is essential to dispel these myths. Sexuality does not have an expiration date. As long as there is willingness, it is possible to find ways to feel good, whether through stimuli that awaken desire, medical resources that help with lubrication or erection, or a new way of understanding intimacy that goes beyond traditional models. A first step is to talk without shame, without feeling that the subject is forbidden or strange. Seeking professional help is also very valid, as there are doctors, therapists, and psychologists specialized in sexual health who can guide you on the best practices for each case. Many studies indicate that the search for pleasure and sexual fulfillment continues to be present in different age groups, including the elderly. What may change is the way of reaching orgasm or experiencing intimacy. While younger people may value a more immediate and intense response, those who are more mature may need more time to get there, and that's okay. No one needs to follow a rigid pattern when it comes to sex. The pace may be different, but the pleasure can be the same or even greater, because with experience also comes the freedom to explore sexuality in a more conscious and calm way. It is interesting to note that sometimes people rediscover themselves at this stage in their lives. With retirement or with children who are independent, there is more time to focus on their own bodies, their own emotions, and their relationships. This can be a golden time to recover emotional closeness with their partner. If before the couple had little time due to work, home, and children, now they can look at each other more calmly, rekindle affection, conversation, touch, and experiment with new forms of intimacy. All of this strengthens complicity and keeps the relationship alive and interesting. Some people think that hormonal changes or chronic illnesses completely prevent an active sex life. This is not always true. Often, lifestyle adjustments such as practicing regular physical activities, adopting a balanced diet, taking care of your sleep, and controlling stress end up having positive effects on sexual health. Aerobic exercise, for example, improves blood circulation, which is essential for men who need good blood flow to maintain an erection. And for women, lubrication can also improve with good hydration, a diet rich in nutrients, and, if necessary, with the use of products recommended by a professional. Communication is a powerful tool for the success of any intimate relationship. Talking openly and honestly with your partner about what pleases you, what makes you uncomfortable or insecure, and even about your deepest desires can help you avoid that feeling that something is wrong, but I don't know how to fix it. Sometimes, a simple adjustment in the way you approach physical contact or conduct sex can make all the difference. When one partner understands that the other needs more time or different stimuli, sex becomes more pleasurable, with less pressure and more complicity. Furthermore, it is important to have regular medical checkups. As the years go by, some conditions may become more frequent, such as high blood pressure, diabetes, arthritis, cardiovascular problems, or even chronic pain. These conditions in themselves should not be seen as a sentence that your sex life is over. However, they do require greater care, as certain medications can affect your libido or sexual responsiveness. If this is the case, you can adjust your medication in conjunction with your doctor or seek alternative therapies. It is never too late to seek professional advice and clarify any doubts that are often hidden away. It is also important to talk about the emotional side of this process. In adulthood, some people go through moments of loneliness or sudden changes, such as widowhood or divorce. At this time, self-esteem can be shaken and the desire for sexual relations can diminish. However, at the same time, the desire to have company or to have new experiences does not disappear. If the opportunity for a new relationship arises, the fear of failing in intimacy or not meeting expectations can create emotional barriers. At this point, it is worth investing in self-knowledge, dialogue, and even couples or individual therapy to work through these fears and insecurities. No one should feel ashamed about wanting to resume or improve their sex life after the age of 60, 70, or 80. The stigma surrounding sex in old age still exists, but it is possible to break away from the idea that only young people are allowed to experience pleasure and intimacy. On the contrary, maturity brings a special kind of wisdom and sensitivity that can greatly enrich the sexual experience. It is common to hear reports from people at this stage of life who say they feel freer to explore fantasies, to indulge themselves without rushing, and to value each touch as something unique. To keep your body and mind ready for sex, a positive strategy is to combine factors such as good nutrition, physical exercise, and relaxation practices. A diet rich in lean proteins, vegetables, fruits, and healthy fats helps regulate hormones and keep your energy levels high. Daily walks or yoga classes, for example, can improve flexibility, circulation, and even relieve pain that could otherwise interfere with intimate contact. There are also breathing and meditation techniques that help control anxiety, improve focus, and make the most of every moment. In cases where there is a really persistent problem, such as erectile dysfunction or low vaginal lubrication that causes pain, advances in medicine can be great allies. There are very effective resources to alleviate or resolve these problems, whether through creams, hormones, prostheses, or specific medications. Responsible use and guidance from a doctor makes all the difference, preventing the person from trying solutions on their own and taking unnecessary risks. It is common to be afraid to talk about these topics with the doctor, but a good professional in the urology, gynecology, or psychology field is used to dealing with intimate issues and can offer valuable advice. When it comes to sex in old age, we cannot forget the aspect of protection. Although fertility is no longer a concern for many people at this age, sexually transmitted infections can still occur. Protection through condoms continues to be essential, especially in new or casual relationships. Taking care of your own health and that of your partner is an act of responsibility and affection, which guarantees safety to experience pleasure without additional worries. One point that deserves to be highlighted is the way we see our own bodies. In many cases, aging brings changes in appearance. Wrinkles, sagging skin blemishes, and so on. This can generate shame, insecurity, and even keep a person away from any situation in which they need to expose themselves physically. However, self-care and acceptance can change this view. Taking care of yourself, recognizing the beauty of the marks of time, and remembering that these marks carry stories and experiences can restore self-esteem. A partner's respectful touch also helps you realize that intimacy is not just a question of aesthetics. It is also about connection, affection, and unity. For those who feel uncomfortable with the idea of resuming their sex life after a long time, or for those who have never had very good experiences, it may be worth starting slowly. Invest in affectionate gestures, such as long hugs, kisses, massages, and gradually progress to where it feels comfortable. Pleasure can be found in each little discovery, not just in the sexual act itself. And if desire does not appear immediately, that's okay. Stimulation, comfort, and the exchange of affection can awaken libido gradually, without excessive demands or deadlines for it to happen. Another tip that can greatly improve the quality of relationships is to educate yourself and be open to talking about new techniques and alternatives that make intimate contact even more satisfying. Some people find that special lubricants make a huge difference in comfort, reducing friction and preventing pain. Others are surprised when they try toys that, when used wisely, bring new sensations and awaken the couple's creativity. All of this can be discussed together, always respecting limits and personal preferences, but without being afraid to innovate, especially if it contributes to the well-being of both parties. It is important to emphasize that sexuality in old age is not limited to a physical act. It encompasses the way in which one sees life, the affection one has for oneself and for others, and the extent to which one allows oneself to feel pleasure in different ways. Orgasm is not only a biological event, it is also emotional, depending on the willingness to surrender to the moment and to feel that there is respect and freedom to explore sensations. The more one works on this emotional dimension, the greater the likelihood that the relationship will be fulfilling. Some health professionals recommend targeted therapies for couples who face difficulties in this area. In some cases, simply changing your perspective can help you approach your sex life more lightly. Breaking out of your routine, trying out different environments, exchanging confidences about your intimate desires, watching movies that inspire you as a couple, and even reading books that address eroticism in a sensitive way can broaden your perspective on the subject and bring more fun to your life as a couple. In other words, there is no reason to think that sex in adulthood is something monotonous or boring. On the contrary, it can be a phase of remarkable rediscoveries. It is often in maturity that people begin to prioritize quality over quantity. This means valuing more the touch, the kiss, the preparation, the prolonged caresses, and the sincere conversation that precedes the act. In this sense, intimacy can even be more satisfying than in earlier moments of life, as there is no longer as much anxiety about showing performance or meeting external expectations. The focus becomes on genuine connection, shared pleasure, and the complicity that is established when both feel comfortable. It is important to emphasize that if there is any medical doubt or physical discomfort that prevents or makes intercourse very difficult, seeking specialized advice makes all the difference. People often accept the pain or lack of desire, believing that it is normal for their age. However, this type of resignation can prevent the individual from having pleasurable experiences and feeling fulfilled within themselves. Each case is unique, and only a qualified professional can evaluate and prescribe treatments or adjustments that contribute to improving performance and satisfaction. When it comes to overall well-being, quality sleep plays a surprising role in regulating hormones and sexual stamina. Getting a good night's sleep helps your body recover and maintain healthy levels of testosterone, estrogen, and other hormones linked to sexual desire. That's why, in addition to taking care of your diet and exercising, setting aside adequate time for rest is essential. If you have problems with insomnia or sleep apnea, resolving them can bring benefits not only to your daily energy, but also to your sexual performance. The mind plays a crucial role in how pleasure is experienced, which is why meditation and relaxation practices can be very helpful. By learning to focus on your breathing, releasing tension, and staying in the present moment, you can intensify your sensations during sex. Instead of letting your head fill with worries and random thoughts, you can enjoy every detail of physical contact, recognizing that pleasure is a combination of physical and emotional stimuli. Those who meditate frequently tend to notice a greater ability to focus and better control anxiety, which results in more satisfying intimacy. It is also important to talk about the importance of respecting your own limits and those of your partner. You may not always be in the mood for a full relationship, and this does not mean that there has been a failure or a lack of love. There may be days when your body or mind does not respond so well, and that is okay. In these cases, it is worth investing in other forms of complicity, such as a loving conversation, a hug, or a massage. The important thing is not to let frustration build up and become an obstacle for future times. Maintaining an open dialogue about these situations helps a lot to preserve the harmony of the couple. Many people, as they reach old age, also begin to value their own time and the quality of their relationships more, including their relationship with themselves. This may be the ideal time to invest in self-knowledge, seeking to understand what really brings pleasure which caresses are most stimulating, which scenarios or fantasies may be interesting to try. Even without a steady partner, it is important to remember that self-knowledge and the possibility of feeling pleasure are rights that do not depend on age. Many women and men at this stage discover, for example, that they can satisfy themselves alone, and that this is not a reason to be ashamed, but rather part of a healthy process of staying connected with one's own body. Some people prefer to keep this topic private, and this is a personal choice. However, it is always inspiring to see that, when people talk openly about sexuality in adulthood, more people feel the courage to seek help, share experiences, and realize that they are not alone in their doubts. Sharing experiences can help find creative solutions and inspire others to seek new ways of experiencing intimacy. This is why communication channels, such as videos, lectures, and discussion groups, are so important to break taboos and provide more information on the subject. When we realize that old age can be a time of expansion and rediscovery, it becomes easier to face aging with enthusiasm and curiosity. Some say that libido is the want to live that is also reflected in sexuality. Therefore, cultivating hobbies, passions, friendships, and moments of joy can have a direct impact on the disposition for sex. Maintaining an active social life, even if in a more relaxed way, stimulates the brain and heart, reducing the risk of depression and improving quality of life. And when the mind is well, the body tends to respond more positively to erotic stimuli. Finally, it is always good to emphasize that each person has their own rhythm and that there is no right or wrong when talking about sexuality and maturity. The important thing is to take care of your health, be open to dialogue, seek practical solutions to possible problems, and above all, allow yourself to feel pleasure. Those who give themselves this opportunity realize that living each phase to the fullest brings benefits not only to the individual themselves, but to the relationships around them. Pleasure can be understood as something broad, which transcends the sexual act and involves complicity, affection, respect, and genuine affection. This more complete view of sexuality tends to increase satisfaction and happiness, because it is no longer something restricted to performance or external expectations. It is a question of intimacy, and intimacy is built on a daily basis, through small gestures, through the willingness to take care of one's health, and through acceptance of the changes that time brings. When one sees sex as part of self-care, it becomes lighter and more natural. And old age can indeed be a phase of great connection with one's own body and mind, without the demands that often come with youth. It is very significant to note that, by talking openly about these issues, many people feel freed from a burden of prejudice that existed. Frank, non-judgmental conversation opens doors to solutions that range from adopting new habits to seeking professional help. The important thing to remember is that you don't have to go through this alone. Doctors, therapists, support groups, and reliable materials can guide, support, and offer up-to-date advice to improve every aspect of your sex life. All of this contributes to a more positive view of aging and shows that old age can be a vibrant phase, full of discoveries and pleasure. Therefore, the message is, there is no limit to the search for satisfaction, connection, and joy in intimate life. As long as there is desire and mutual respect, sexuality can be cultivated in a healthy and pleasurable way in old age. It is essential to continue talking about the subject, sharing information, and above all, respecting your own body and that of others. Sex does not have to stop when your hair turns gray. It can, in fact, take on a new meaning, deeper and more conscious, bringing satisfaction and strengthening emotional bonds. This self-care, combined with the search for pleasure and happiness, is one of the pillars of a long and rewarding life, full of moments that are worth living in every detail.